a great day. Well, many of us will experience back and neck pain at some point, but for our next guest, it was debilitating and constant. The doctors at Sandstone Chiropractic helped her to feel normal again. Please welcome Dr. Lindsey Thomas, along with her patient, Allison Kleinpeter. Good morning.
Good morning. How are you?
Okay, Dr. Thomas, let me first have you explain what chiropractic medicine is. I think sometimes people are confused about that.
Absolutely. So a chiropractor deals with the spine and a chiropractor deals with the nervous system, and we do that through natural means. We're not using any other intervention like drugs or medication.
Yeah, and you help the body help itself.
We help the body heal on its own.
Okay, and a number of ways to do that. We'll talk about that in a second. But first, Allison, so there's back pain and then there is back pain. Explain how crucial it was for you to find something to do.
Well, it starts with discomfort, right? So you kind of have the muscle spasm, this discomfort, and things that you can kind of manage. It just progressed and got worse, and I was...
Was there an injury that was caused, or did
no,
it just...
it's just, I mean, I kind of have some issues, but it's really just the day-to-day stress that I was under, and I realized that I had the wrong posture, and it's just creating this tension, and the pain was causing me to be irritable. It was causing me to be, I had to apologize to my family. Like, I'm sorry, Mom. Mom's just a little...
Well, that's what stress does. It comes out sideways, right?
Right,
it comes out somewhere.
And so whenever my kids were like, oh, okay, you're in pain, I'm like, well, I need to do something. I'm not my best self. And I was getting these horrible headaches.
Well, the number one thing a lot of us do is we go and we start self-medicating, right? You find the medicines for headache, a medicine for back pain, the muscle relaxers. Did you try the over-the-counter stuff?
I did, absolutely. And it got to where that wouldn't help. It didn't help the headaches that I was having. And then as a mother, you put yourself last.
Right.
So at some point, it got to where I couldn't drive properly. Like I could not turn my head.
You're shutting down. That's what you're shutting down.
Yes, my body was in complete shutdown.
Yeah.
So
and
that's
Dr.
when
Thomas,
I sought help.
The thing with a lot of medications that people have to understand is that you're covering up the symptoms, but the problem is still there. You have to get rid of the problem.
Absolutely. It covers the symptoms, and then you go back to your regular activities, which then it makes the problem even worse. So when it comes back, it's worse than it was before, and it doesn't go away like it used to.
Okay, let's talk about the treatment you did for her, and then we'll talk about some other things that are available.
So when Allison first came in, we put her through a full examination, and that included x-rays so we could get a good look at her spine, and we also did some other testing to take a look at her nervous system. We did a surface EMG, which takes a look at muscle tension, thermal scan, which is going to take a look at nerve function, which then allowed us to get the complete picture. Yeah, because she just wasn't a pain patient. She had a lot of stress going on as well, so we needed to address both areas.
Yeah, what's interesting is how much stress can cause this.
100%.
Okay, so treatment-wise, what did you lay out for her?
So initially when she came in with pain. We needed to address that first, so we put her through a relief phase to get the pain under control. But then beyond that, we took her into a second phase of care where we really worked on strengthening the spine and also all the soft tissue around the spine too, which that's where she's going to get that long-term relief.
Yeah. How do you do that? How do you strengthen that area?
So on top of the adjustment, which is the most important thing that we do in the office, we add in different stretches and exercises. The stretches are geared towards postural correction, the exercises as well. And then we also give her things to do at home, because that's the important thing. We can do everything that we do in our office, but if you're not doing good things outside of the office, you're not going to have the results that we're looking for.
And it's interesting because a lot of times people think if I have back pain, exercise and stretching is the last thing I should do. Actually, it's probably the first thing you should do, but the right way.
Exactly. And so really in the first phase of care, we're not doing a whole lot of that yet because we need to get the symptoms calmed down. But, within the first 3 to 4 weeks of treatment, we're absolutely introducing that once the patient feels better, because then they're going to start seeing the positive effects of that.
Yeah, because a lot of times on the back, we feel that tightness in the whole bit, right? It's like basically those muscles are squeezing down.
We're scared to do it. We don't want to make it hurt more.
Yeah, yeah.
So
you got to relax that, but do it slowly.
Yes.
Okay, so how are you feeling today?
I'm feeling great, and I mean, it's really...
It's been a great journey with Allison. She's now been with us for the last 2.5 years, and she's done great. She's learned what she needs to do at home, and now she sticks with us just for maintenance to keep everything healthy and feeling good.
I got to. I was waking up every morning with severe head pain, and I was just, I didn't know if it was my pillow. I changed pillows. I did all that type of stuff, and nothing was working. And then Dr. DeRamus, just one day on the set, he goes, "I'm going to do this." Did the adjustment, and headaches went away.
Absolutely. The adjustment is very powerful.
Yeah, and it's hard for us to believe that, though, because we keep thinking, no, there must be a pill or a surgery for me, right?
Absolutely.
Sometimes there has to be a pill or a surgery, but other times, like you just mentioned, the body just needs you to pay attention to it, and there are things that you can do to alleviate the symptoms.
Absolutely.
All right, ladies, thank you very much.
Thank you very much for having us. We appreciate it.
The kids have their mommy back, right?
Yes, they do.
And you're not irritable anymore?
No,
Oh.
I sleep well now, and I'm not in pain. And pain is a miserable thing, so
Yeah.
I'm very happy.
The kids are like, thank you, Sandstone
Exactly.
Chiropractic. To make your appointment with Sandstone Chiropractic, call 936-851-1631. 936-851-1631. They have 3 locations. You can also log on to sandstonechiro.com.